for this from now on. Okay, so to answer your question, which is an absolutely intelligent question. So here at Mayapur, okay, generally speaking, midwives in this day and age are trained. They know how to recognize an issue and how to respond to it. And actually, the issue isn't with us transferring a patient. The issue is with the hospital receiving the patient. That's the problem. So whereas it's kind of unfair to look at, okay, I can explain this further. Okay. With MayapurMidwives as an example, and even before I created this group, MayapurMidwives, when I was working alone. So this is over 1,500 births, and absolutely, you're going to need to transfer some of these people without question. And so I did. Now in the West, it's no problem. And number one, I am trained. I do know how to recognize the problem. I also am the servant of the mother. I'll say that again. I'm also the servant of the mother. So I do educate the mother. I prepare them for their birth. And then there's a point, if they wish to transfer, if we make a decision to transfer, you pick up the phone, call an ambulance. The ambulance comes and picks you up and takes you to the nearest hospital. End of story. No more, you just get treated as you would for any obstetrical issue or complication. Now in India, it's another story altogether. I still can do the same thing. I still bring all kinds of emergency equipment. One day I can show you what I take to births. It includes resuscitation equipment. It includes IV equipment. I carry oxygen. I carry materials to suture. I know how to suture. Hemorrhaging, oh my God, hemorrhage is a very, very common issue around birth. So I'm trained. I know how to deal with these issues, and I carry equipment. In MayapurMidwives, we're a school, and I teach other midwives how to recognize and address such complications. Now, to be clear, in my experience, easily 99%, 97% of my experience has been without complication or issue of any kind. Now with the remaining 3%, if you make that 3% 100%, probably 90% of that I can deal with at home. Yeah, no issue. The rest I got to transfer. Again, overseas, no issue. Come to India, politics. Politics. Now you have a problem. Okay, yes, the ideal is to have a backup doctor. Even in the West, this is what I had. I worked a very big circumference. I dealt with, I think it's a circumference, 5 hours, 2.5 hours in a particular one-way direction. So you have to deal with various different doctors in different hospitals. So I did have doctors that would back me up and support me, and I could trust them and they trusted me, and we worked together and we had great harmony. And that's the ideal system of support, exactly like in the Netherlands, like you're discussing, Geraldine. Christina knows this, Krista knows this too. And that's why that country, those countries around with this system, they get the big tick. They get the really good ticks. They have the best birth rates because of that harmonious connection. So we have a problem here in India where the harmony is not there. You have got a lot of ego out there, and I have to fight the ego. So it still remains an issue to be resolved, is all I can say. Having said that, we have done 3 transfers in the past year. So out of 21 births, I think, something, out of a bunch of births, 3 of them transferred. And I have to say, in this 1 year has been my worst birth statistics in all my previous 50 years. And because people are scared of the pain of labor. I don't have a magical cure for this. Just relax.
I think that's where the antenatal care comes in. Is the woman, is the mother, and the father helping her. That's where the, the relationship comes into the picture. The two have to really practice the birthing, I mean.
And not just that, I'm trying to create a new thing in India. When people get pregnant in India, everybody comes to them and starts. I had a couple here yesterday, 4 weeks pregnant. And already people are telling them, oh my God, you have to get an ultrasound. You have to get a blood test. You have to go see the doctor urgently. Are you sure you can do this? It's really painful. Have you scheduled when the best time for your cesarean section is? Come on. This is how people approach pregnant women these days. And I'm telling the husbands to please, this is your job. When people come to your woman like this, you need to protect her. You tell everybody to shut up, go away, Don't, and I want to say this now, you're being mean. Why are you being mean to my wife? Why are you scaring my wife? Don't be mean. So I want all the men to learn this. I want all the men to respond this way to whoever comes up to another woman and thinks it's okay to scare her like this. It is not. Let's stop that. I want everyone to go, in the West, we see people who are pregnant and you hear about them being pregnant and you jump for joy. You're so excited. Everybody's happy. They're giddy with their light. They're a little nervous about having a baby. They're nervous about the new adventure they're on and can't get off. But they're excited. People aren't coming there to scare you. So we need to, I think, change that culture. So let's do that. But after that, okay, we still have new people here. Who's next? Veena. Thank you, Geraldine. I just want to meet everybody. I can get off the subject very easily, right, Devasya? So, Veena, are you there? Who would like to introduce themselves? All right, Radha Kund, I know you're there.
What?
I'm trying to get people to introduce themselves.
Oh, hi, I'm Radha Kund, Krishna Lalia Mataji student. I don't know what else to say. I live in Mayapur, and we are training with her hands-on. Beautiful experience and very excited journey. And so far we've delivered I've witnessed 4 successful deliveries, and I'm looking forward to more. But yeah, that's about me.
Right. But you've had 2 kids yourself, right?
Yes, I do have 2 kids myself, an 11-year-old boy and a 7-year-old girl, which were both home births, delivered at home. Yeah. One of them, the oldest, was delivered by me and my husband, because KL was supposed to be my midwife, but she left around that period, and now my son was 2 weeks.
It was probably my mother's fault. I'm sure it was
your mom's fault. Yep, it was her fault, but it was for the best, because to give us strength yeah, she left 2 weeks before my due date. So the baby came 2 weeks early. And we just did it with her guidance from the prenatal and everything. We just did it by ourselves. Yeah, by the time I called for another midwife backup before she came, or right exactly when she came, the baby came out. And yeah, it wasn't scary at all for me. I mean, a little bit, little bit. But I was more focused on having the baby and less fear. Actually, I had no fear, to be honest, because I don't think I was really prepared for what to expect in terms of pain, you know. I feel like there was no pressure or fear mongers around me. So I didn't have that fear at all. Actually, my only fear was going to the hospital. So I only had one job, and that was to deliver the baby. Otherwise, it's hospital. And I know the hospitals here don't treat you very nice. And so I really had no other choice than to have that baby. So I put in all I had, and whatever it took to have the baby. And it happened 8 hours, and you know, he came out, he was excited, looking around. And yeah, he was successful. My second birth was in the US. We did have a midwife in the US for my daughters. That also was successful. Yeah, my kids have no issues at all. Yeah, they have no issue. They're happy. I'm happy. So I want to encourage other mothers to at least be there to support them in a less fearful manner. Now, if you're surrounded by people who scare you, I want to be that one person that, you know, does not scare you. So and it's nice to have Krishna Lilia Mataji in our team, because she just teaches so much love, you know, so much love, you know, service to the mother. She's the queen. She comes first. Nothing beats that. Nothing beats that. You know, with that service attitude, you want to give her best. You want to give the best you can offer, you know. So yeah, hopefully we're able to encourage more mothers to relax, to relax and have their baby and enjoy the journey and the moment.
I like what you said too, that you only had one job, and now I'm going to use that at the next birth, right? You know how I like to hassle the mothers. I'm always I'm always playing, you know. So that's it. You've only got one job to do. You've only got one job.
Push your baby out. Forget about everything else. Forget about family. Forget about
place. One job. Do it.
Yeah. Get to work. Yeah.
Good one. I'm
going to let somebody else speak now.
Okay, Saman, I see that you're here. I'd love to hear your story. Welcome back. Yay. I think you have some news. I hope she gets to the camera. Okay, if she doesn't run to the, okay, 5 minutes. Who's got a 5 minute?
She won't talk to you if you keep calling her Saman. Call her Saman. She will
Saman.
come.
Say it again. Say
Saman.
Saman. Saman. Okay. Saman. Man, I'm going to give you guys my name. There you go. Good luck. I'll give you only at the beginning. Bet you can't even say that. You're muted.
No,
Geraldine.
I give up. I can't see. I can't say that.
What does
Kavohi.
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 Kavohi. Yeah.
Kavohi.
Kavohi.
Kavohi. What does it mean? What is the meaning?
That one's beautiful, but there are Yeah, this one's a delicate beauty. A delicate beauty. The whole, that's only part of it.
Is it
Beautiful,
an,
yes. Delicate, no.
is it an Aboriginal
Actually,
name?
I heard recently it was something else too. Hang on. I'm having trouble with my typing these days. On a
Kawohi. Is it an Aboriginal name?
that's my real name.
Kawohi.
And even those hyphens are considered left letters. They're called akinas. So, okay, who else? Who else?
Okay, so if nobody's speaking, I would invite Sneha to talk about the birth. Because this was her first birth as just her, nobody there. Like last home birth, one of our sisters, Ramiza, who's a nurse midwife, she was there. But this time, it was just Sneha, father, and the mother. And it was a home birth after 2 cesareans. So-called, high risk. Even birth centers in India won't take you if you have more than 1 cesarean. So I would love her to talk about it. It was a beautiful birth, and I was there on phone, but I just knew that she's got it. I didn't worry like a minute. I just knew, I had faith in that mother that she would do it, and I had full faith in Sneha that she was fully capable of doing things. So yeah.
So thank you so much, Tapasya, but I don't know what I need to say. I'm so sorry. So,
What? You just tell what you felt, what you experienced, that's all.
okay. So I think this mother, her name is Mahinur. So her sister-in-law, just 2 to 3 months back, I think she was in her labor, and she messaged in the Birth India home group of the Pasya that, my sister-in-law is having this and that. I think it was in the midnight 12 or 1 a.m. And I just happened to call her, just to support, understand her situation. And then I got to know that she's also pregnant and she's looking for support. So that's how I got connected. That I told that I stay very close to you, and I'm a doula. I can support you in that way. And then things happened. The sister-in-law, she had a cesarean for no reason. And later on, I had Atika's birth, the first home birth, which I did with Tapasya, where I had taken my friend Ramiza, who is a midwife, but she's not working, but I managed just to take her. Again, there, Tapasya told me, "Are you scared that you want someone there?" I was like, "No, but I really would like to have someone who is, a midwife, or why not having an extra help?" And because Atika's husband was a zero support, so I always feel that, having someone with me would definitely help, and that she really helped me. So that was Ramiza. So again, the stories Tapasya shared on the group, and that got Mahinur. Okay, I want to meet you, sister. We want to, know each other. And then life happened, as Tapasya always says so many great things, which I always tell, like, itna nahi tarif karo. Do not say this to everyone. But then she, being she is, so she was like, I really want to meet you, sister. And I'm so glad that this time the house was just 10 minutes away, because the last birth I traveled from 3 local trains. It was like 1.5 hours, away from my home. But if I would have gone from roadways, it would have taken me like 2.5 hours. So this house was like very close to me. So I was really excited. Um, uh, and though I supported one mother with for a VBAC, but that was in Kolkata. And you know what is Kolkata. So she had to go for an cesarean, and that made me a little upset. And I did not knew that, anytime I would get a VBAC candidate or a VBAC client to work with. So this was something which I was looking forward to. And being the month of Ramadan, it was really, really special. So Mahinur was a kind of a person who knows what she wants to do, but she's so much engaged with her children that I used to beg her, "Can I come for prenatals? Can we meet? Can we have some sessions?" She's like, "No, sister, I cannot process if my son is around me." I was like, "Okay." And there was like, I just met her once, and she felt great. I just met her. I spoke to her. We did some rebozo. I did some massage to her with some essential oils, and gave some guided meditation. Made that room dark, and she just fell asleep in our prenatals. And she was like, "I never felt this before. My husband never even touches me to give a massage." I was like, "Yeah, that's what a doula does." And since then, every week I used to message her, "Can we meet for the next prenatal?" She's like, "No, sister, I'll meet you afterwards. I'll meet you afterwards." And the time came when she called me. Oh, it was like pre-labor time. They're like, "Okay, let me come and see how it is going." So I went again. I did some rebozo. She felt better. I did some massage. Again, I made her sleep, and I tried doing labyrinth with her just to see, where she is and how is her thing. So she was kind of a mother who was like she always felt that, I don't feel anything wrong in my body. I would be able to do this. But you know what? My husband is scared. My husband wants to have an option B. What to do? I was like, okay, I'll also talk to him. And Tapasya had already been in touch with them. So I also tell my doula sisters, when they are like, "Oh, Sneha, how did you do this?" I always say that I like to work with Tapasya's client because they are like strong-headed women who know what they want to do. They are like clear. I know it is painful for them, but then for that I am there. And like, the spouse is there. But the determination, the commitment which these mothers who work with Tapasya or who get those knowledge or wisdom from Tapasya, they are like very different than the other mothers whom we work with. So again here, she was in pre-labor since a week. While I had zero experience for how does a VBAC mother, VBAC labor goes. So Tapasya said, and Tapasya, I'll tell you how she speaks. हाँ बहुत time है. Kale, I don't know if you know Hindi, but this is the way she'll speak. अरे लंबा चलेगा. 3 दिन है, 4 दिन, कुछ भी हो सकता है. Okay. So pre-labor time, I was like, okay, I'll just go and visit. I said, it will take time. The most frustrating thing
What
is,
does that mean?
sorry,
What does that mean? What's the question?
she is telling, just wait, it will take time. 2 to 3 days are more there for her pre-labor. I was like, what? Pre-labor 2 to 3 days? So that is what she used to always tell. So as I did not had this experience of pre-laboring mother, because I did not had a big pre-labor, neither any of my clients had. So this was the first one, like, and she was also having this discharges. So for me, one of my clients, she had mucus plug discharge. Next day, she had the baby. Now she's having mucus plug, mucus plug, mucus plug, and there's mucus plug coming in and bleeding. So I was like, Tapasya, do you think like there is some issue with the position or something? Again, one statement from Tapasya: Sneha, chill. She's multi-para woman, had multiple cesareans. Multi-para women will have long pre-labors. Okay, that's it. For me, one statement from her always makes me like, yeah, I'm set. Nothing more to do. Nothing more to ask. And I also feel that I'm someone as an individual who believes in the person and who would love to follow her, like anyone, like that way. So in that way, I'm a good follower, I feel, and that's what I did with this. Now comes the time of Eid. Okay, so we were anticipating, let's have, she was so much in her head. Now, before that, the husband was getting scared. He was like, let's do one scan. Let's do one scan. And Mahinur had fasted for 20 days and she knew it very well. That how aware she was, that much, awareness that if I would have gone to the scan center, definitely they will tell you there is low amniotic fluid, there is this, there is that. So she knew that. Which I felt it was true when I saw the birth, because there was actually like little water dripping here and there, and then the baby came out. So because she was fasting, she felt that she was not comfortable going for a scan. Now this is a huge, big joint family staying in one roof, and she has not mentioned about her home birth to anyone except for her husband and the sister-in-law who had a cesarean few months back. Now because she had this pain, she really wanted to support her sister-in-law that, Bhabhi, I'm there with you. So only these three people, big house, like, such a, like, I think there would be 15 people living in that house. And people like wondering, she was like, Mahinur was stuck. I want to do it before Eid so that, when people come for Eid, they would, I will be sorted. I do not have to answer questions, because everyone was like, when are you going to be due? You're so much, down there. The body is so lightening. You should go for a C-section and stuff like that. And now the husband, so in pre-labor, me and Tapasya, we were managing the husband. She was managing the contraction, but we were managing the husband. We said, what is your fear, brother? No, I just want to see where is the baby. So we were like, the fact that the baby is pushing, she's feeling those contractions, the bleeding and a mucus plug is coming, that means the baby is at the right position. Now, I felt somewhere that the brother, the husband was not comfortable taking it all alone. So what happened was, Mahinur, her mother-in-law and her sister-in-law, they were all together. And then the husband comes. Before that, Tapasya had spoken to the husband and said, you don't need it, brother, leave it. It will happen. Just wait, be patient and stuff. Again, that person went in front of the mother. He said, let's go for a scan. Now, she got frustrated. Like, why are you pressurizing me so much? Then she was so sharp. She said, okay. She said, like, I'll tell in her dialect. Ammi, tell me, when do you used to go to the hospital when you gave birth to your babies? Now she have, I think, 5 or 6 children, the mother-in-law. She said, yeah, we used to manage at home, and when we couldn't, 7 children, 7 children. She said that, we used to manage everything at home, and when it was like very unbearable, we could not talk to anyone, we could not wait, we could not sit. That is the time we used to go to the hospital. So she said, look, and did you go for any scan, mother? She said, no, scan? There were no scans, Look. And so she said, then she questioned and answered. They were having this discussion between the mother-in-law and the daughter-in-law, wherein the husband was just observing that what is the mother-in-law going to say. So when the mother-in-law said, she's doing fine, मुझे लगता है ये अच्छे से कर लेगी, मतलब she'll manage the labor well. Mother-in-law did not know that she wanted to birth at home. She thought the doctor, so there is this bungalow of theirs, and in just outside their gate there is a maternity home. There's a nursing hotel, sorry. So the mother thought that, okay, she would manage her labor and she will go. So she said, no problem, she's doing fine, I think. And then the husband was like, he smiled, and that was the last time that he asked about scan. Because now he was assured that at least my mother and my sister, they are aware of what is going to happen. And we felt that, he was calm, now he was composed. He was like, okay, whatever you sisters tell me, Tapasya and Sneha, we will do that. Okay, now she was anticipating Eid day. A day before Eid, I just visited her. I just gave her good rebozo. She was looking for some shaking of the apples and some good labor blend essential oil I used on her. And after I left, her contraction started, being better. So if as the mothers, have these cycles of no contractions during the day when they are busy with the kids, and the contractions taking it high when at the night time. So this time after I left, she had like good pains coming and going. So she was managing well. Again, on Eid day, the mother-in-law is like, why don't you go for a scan? And this is not the pain. This is not the pain. You're talking to me. You're coming down to the ground floor. You're eating. This is not the pain which happens for the intense labor. So she was like, now I'm getting frustrated. She was like, Sneha, where are you? And I was on the Eid day with my family out, for a dinner or for some just adventurous rides. So she said, and then only we saw some fresh mucus, the red bloody show happening. And Tapasya said that I think Sneha, you just go and visit her, see what is she up to. And because we did not understand her pattern at all, how is the labor going? Because pre-labor was there, and later when she's saying, "Oh, I think the pains are frequent," but there was no rhythm, or there was no proper understanding of what the contractions are happening. So Tapasya said, just go and see how is she feeling and just understand her pattern. I was like, okay. When I went inside, when I reached, it was like 10 p.m. in the night, 10:30. So the mother-in-law and the husband, they welcomed me, while the mother-in-law was looking at me like this. What is she going to do? Who is she? So I was like, no, I'm just a friend. I'm just a friend. Nothing, nothing. She's like, see, now she is having labor, but she's talking. I said, what time, Abby? Yeah, yeah, yeah. She might be in early labor or something like that. So the Mahinur had this thing that now everyone is judging me, everyone is questioning me, and I cannot take this. So I want someone to emotionally be with me, and I really wanted Sneha to be there. So I was like, okay. The previous night where I went and did rebozo and then I came back home, we thought that the contractions were moving. So that night would be the night where I had to go back to her. So the whole night, every 1 hour, I used to see the phone, keep it, see the phone, and there was nothing happening. She was also awake, I was also awake. So this time I told Tapasya, at home I went, I couldn't sleep last night. Today I'll sleep with her. At least she is managing her pain and I'll have a good sleep. So she was like, okay. And I wanted to sleep without my children. So that's the reason I was like, I'll sleep. And so she was like, oh, can you do some rebozo? I did some rebozo to her, and I prayed my salah, and I was like, okay, now go and let's sleep. Okay, we need to sleep. Early labor is something. And then I understood the pattern. So I just messaged Tapasya that nothing to do now. It's early labor, and I'm going to sleep. She's like, okay, go sleep. So I slept, but she did not sleep. She went down to her sister-in-law's baby. She was doing this, she was doing that. I do not know why, but I slept well. And then in the morning, the pains were in the same pattern. So I said, okay, like I'll leave for my place now. I'll just go home. Now the husband was like, every now and then he used to come and say, what do you think? How much time? What do you think? How much time it will take? Do I need to take her to the hospital? I said, no. Then I explained him that, multiple cesareans do take a long time, and the uterus are not, they are not equipped with what labor is. So that takes time. So he was like, okay. So Firbi, while he was driving me back home. It was like, he said, I'll drop you. I was like, okay. So he's like, hey, tell me what to do now. Everyone is asking in the house. I do not know what to answer. I was like, tell them we will have the baby in few days. Then this is too much focus on getting. Sorry. Yeah. And then he was like, I was like, okay, I'll assure you, brother. Now she's in early labor. Definitely she'll give birth by Sunday. Pakka. Write it from me. Then he was like, okay, you're saying this, and I'll talk to Tapasya's sister also, and I'll wait. Like, yeah, please, you wait and you be there as a support. Now, these two couples also had a very weird relationship where, the wife is like, he's the one, because of him, I got these two cesareans done. And, not a very loving relationship, just managing and handling the joint family and cribbing over stuff. So that was the thing, and she had made sure. So I just asked her this question when I went to one of her prenatals, that how do you imagine your birth, Mahinur? She said, I want to birth in my room. I was like, okay. And whom do you want around? I don't want my husband to be around. Keep him away. Keep him engaged with the kids. I just want you. I'll handle. I was like, okay. And I'll tell you one thing, sister. I request you. I was like, what? When the baby is born, don't tell him that the baby is baby girl. I think then what should I tell? I want him to suffer for at least some hours. The suffering? What type of suffering? No, sister. He told me that girl, women are meant to bear this pain. What is so new about your labor pain? And you have been laboring since long. When are you going to do all this? So this was his tone while she was pre-laboring and managing her pain. So she's like, I want to teach him a lesson. He wants a baby girl, no? So desperately, I will not tell him that it's a baby girl. I was like, wow, what a kiddish and immature conversation I'm having with you. So I said, okay, I will not tell him. I will just say the baby is born. Okay, I am not going to say the baby is boy and then you surprise him with a girl. I'm not doing that. So she said, okay, you just tell him, but don't tell him it's a girl. Because he wants a girl and I want him to suffer for some time emotionally so that he understands how much it takes for me to bear the pain. Okay, I'll do that. Now came the next day of Eid. So I left in the morning and Tapasya clearly told Mahinur, now no calling Sneha. Now you have to manage your pain. It's you who's going to birth and you have to do, you manage. We don't know. You only call Sneha when you are pushing. You're at the stage of pushing. So she kept quiet. She did not message me until, until 7. She was just talking to Tapasya. So that was a time in the afternoon when me and Tapasya, we were like away from them. Husband and wife, they were managing the contractions. They were managing the pain. He was giving some massage, giving hot water and everything to deal the thing, labor pain. Then in the night, she called me that Sneha, I think you should be coming now. I cannot bear this. And I need someone else as well. I was like, okay. So I reached there by 8:20. And she just had few pizzas. She said she kept few for me. She said, please have the pizza. I'm like, yeah, I'll have my pizza because I know I need a lot of energy now. So while she was walking and swaying, that's it. She did not felt any comfort on sitting or sleeping or lying down. So that was, I think she was ready to walk, but she was so sleepy that, it was very difficult for her to manage those contractions. And she felt only better inside the washroom, like in the toilet seat. Now, while I knew that, people birth in the toilet as well, and we were okay with that, but the husband felt that it is gross, gross to get the baby in the toilet. So, but she was, well hydrated. She managed to drink whatever we were giving her, and while she was on the toilet seat, I think at 12 o'clock something, she just felt she just inserted her fingers inside to feel, and she felt that there's something which is bulging down. But because she was sitting on the spot, like on the toilet seat, so she just felt there's something very liquidy. So she came and she said, you know what, I felt something when I inserted my fingers. I don't know what it is. So we spoke to Tapasya, and Tapasya said it would be the sac. So do you want, she asked her, do you want to know that if it's the baby's head and the sac? So she said, yeah. Then she said that you can do it on your own, or if not, Tapasya said, let Sneha do it. I was like, I am not doing this. You cannot let me do this. I'm a doula, not supposed to do all this. She's like, no. She took the phone, Tapasya. So Sneha, get ready for your first PV. I was like, no, I'm not doing this. She said, no, you're doing it. So obviously, if the mother wants, then you would do it. But just gently put your fingers inside and feel. Close your eyes and just feel. So I was like, okay. So because people know that PVs are tough, PVs are hard. and it's painful. So Minor said, it's okay, don't do PV. I'll get pains otherwise. I think okay. And again she went to the toilet. She's like, will you see? I was like, okay. So now I wore my gloves and I just inserted, and the husband was so excited. My husband was like, "Ned, you have to do this PV. This is important. You sit. We will help you. Nothing will pain. So he was so desperate to know where is the baby's head, and so then I inserted my 2 fingers, and I'm so glad I was gentle. I was gentle, and I could feel the sac, like the sac, and the head was here. So there was water and there was head. I could feel that. And in one while I was doing that, there was a contraction. So Tapasya also told me that in contraction you would feel it much better. So I could feel that the head was moving. Right, yeah, we were like, voila, we're done. Now it's just few hours left. And now, so the husband. So how many hours it takes for the baby to come? It will take few hours, but they're not satisfied with few hours. They want exact hours. So they are very smart. Okay, sister, in your last birth, how much time did the mother took in transition? Please leave all this calculation now. I am focusing on this mother. So I said, see, one of my client, Atika, she had water break at 5:30 in the evening. Then she had water break 9 o'clock. Then she gave birth to the baby at 1 o'clock. Acha, this is the pattern. It is different for everyone. So like, okay. Now the mother was like, if it is so near, why it is taking time? What should I do? And I'll tell you this thing, the whole night, Mahinur only spoke one sentence. It was, kya karu? That means, what should I do? I was like, you are doing it well. So one of the, like in the fraction of all those things happening, she was like, after she's bearing, contraction ho gaya, sab kuch ho gaya, she's like, what should I do? I was like, nothing. Okay. Now again, she went to the toilet. Now she was like, I don't want to come out of this toilet. I want to sit here. So Tapasya said, let's do something. Just face yourself towards the commode, this thing. I don't know what it is called. And you just lie your head there. We'll keep some pillows. Husband was like, no, you're not sleeping here. No resting here. You come out. We will manage. We will do something. So husband created a sofa. We kept the sheet, and he's like, we will give you all support. You sleep here. You keep your shoulder, head on our shoulder. It's okay. And she was like, no, I cannot sit. This is hurting me. I cannot sit. I want a hole where I can keep my stuff there. So we were like, okay. Now, Tapasya said that, I think, Sneha, you take some break, leave them alone for at least some time so that they'll manage themselves. Because every time we are waiting for that, the bulge to come out or the water to leak, it might, just disturb or distract her. So I was like, okay. I said, you know what? I'll go there in that room. And the beauty was they had a huge bedroom, but the toilet was outside. And the thing which she was scared of, that if I want to use the toilet during the birth, my in-laws, like my sister-in-laws, the other sister-in-laws, they would see me. I don't want them to see. But that night was a night when all of the sister-in-laws, they went to their mothers for Eid. So the whole floor was empty. So we were like, wow. And then we were like, she was just conscious about her clothes, no, nothing should be visible. So, but, as we say that, in transition and about that, she'll feel like, removing her clothes. This time her husband was like, Arey, please remove the clothes, man. This is disturbing us. So I said, no, I'll wear my salwar kameez. So like, okay, do whatever you feel like. Just give me 1 minute. So my son has his class online. So now we were like reaching 1 o'clock done, 2 o'clock done. Like transition takes only 2 hours, sister. You told me. I was like, I don't know now what to do. Transition came out. I said, there's one more stage. Like they were like early stage, active stage, transition stage. Sister, what is after transition? I was like, pushing stage. We are yet to reach pushing stage, so have some patience. So now the husband suggested that why don't you go to take some hot shower. So she said, yeah, I'll go and have some hot shower. In the hot shower, she was so comfortable that we spent standing outside the toilet for 2 hours. She did not want to come out. While she was also having these warm showers, I felt that she's getting dehydrated because she was little pale visibility I could see on her face. So I just kept her giving water, juice, some dates to eat, and so she managed her pain. She used to take the shower, sway, and she used to sit back when on the toilet seat. Now, just before going into the water, she did something very strange, which I was like, I was just a little baffled. She went to one of the corner and she took her hair and started eating it. And she's like, what is she doing? She did not feel vomiting throughout. And because I also attended classes with Tapasya, and she told me this, that, put some hair inside her mouth during placenta removal. But she felt that placenta. I do not know what logic she had at that time, but she was just putting the hair inside, and then I was like, "Oh wow, that is amazing!" And then we went to the washroom, showering. Please message her. We went to the toilet. She was showering again, and she was doing this. She was putting her finger inside and vomiting. Message her. Message her. Message her. Tell that he's not available now. So she was puking, trying to puke. She was not getting this vomiting sensations, but she was not getting to vomit, but she was having the sensation which helped the baby. And then I think after 1.5 hours, the first, I would not say a complete water break, but it was just few leaks happening with blood and meconium. Now she said, okay, meconium. The husband was standing outside. He heard meconium. Sister, is it risky? I was like, no, meconium, no, it's not risky. Okay. Again, he was standing outside. He's like, sister, I think, do we need to take to the hospital? I was like, no, we are not going to the hospital. She's doing well. And so that was the only water break she had in the toilet. And then later, after 2.5 hours, he was like, let's go out. Usko bolo ke he's not doing it. So फिर I'm so distracted. So sorry. Yeah. So she was managing it well. She wanted to be here. Like, I will birth in the toilet. He was like, no. Let's go to the bedroom. We will do there. And then after that, we took her to the bedroom. It was 5 a.m. and we had this call for the prayer in the morning. The dawn prayer. And we were like, okay. Now while she was doing, so she was wanted to walk. But after the shower time, she felt like the urge to poop was too much. So we're like, yeah, that's what we need. We need the urge to push and the baby comes out that way. So she was like, okay. So she was walking, and the first time she felt like squatting. I said, brother, you just give her your body. She will squat on you. So he was like, okay. So there was a cupboard there. So he first went to the cupboard and gave her the squat position. She squatted. And his face were like, oh my God, what's happening? This is too much. The father, then he wanted to cope his labor now. So he was like, this place is not comfortable. Let's go on the bed. I'll help you on the bed so that I get good support. I was like, oh, brother, now you are coping the birth, labor pains. So he was like, yeah, it is very tough. I was like, okay. So he went to the bed, took some pillows and asked her to sit. She was like, you want to do comfort for you. I am feeling pain. I am not doing it on the bed. Get out. Let's do it on the floor. So he was like, Arey, you will get rest also here. Only some urge to push and then you can rest. She's like, out. Come out. Otherwise, I'll go to the toilet. He's like, no, we will do it. Then we took a chair. So I asked him to sit and then let her squat. Again, she was walking, squatting. I think the urge to push would be more than 20 times. And now he was like, Abhi push ka stage bhi aa gaya. Sister, when is the baby coming? I was like, wait. I'll call Tapasya. And Tapasya is also very smart. She'll have the call for only 1 minute. And she's like, I'll keep up. Abhi aap log dekh lo. Like, good. Here I'm wanting Tapasya to be there so that we are together. Tapasya is like, okay, now you continue. I'll call you later. So, and I find that also having a wisdom, because, that time and then the moment is very crucial. And Tapasya being online would be like, she'll be more concentrated. What is Tapasya saying? Because, yeah, the mothers, they feel the midwife saying something is very important. So Tapasya just said, yeah. And then while she was pushing, having that urge, we could see again a next bulge coming out. And Tapasya saw that and she's like, yeah, perfect. Now it will take at least 1 hour. Again, she gave one time. Now 1 hour passed. Both husband and wife were looking at the clock. 1 hour, she said. And then I was like, yeah, but we can see. So one example she gave to the mother and the father that made sense to them. Then imagine that you are in the pipe and you have to come out. So you'll roll yourself, rotate yourself, and that will help. So I showed them. And then, okay. So she said the baby will take its time. The baby also needs to get the shoulder out. Now the husband, was like, she was like, I want to go to the washroom. And why is it not coming? What to do? The husband said, now nothing doing. You took care of the baby for 9 months inside. Let's have it one more day. Nothing happens. We'll not go anywhere. We will do this. So they're like, wow, that's amazing. That's something which is like we needed. So he got that confidence. And now one of the things which did happen was, so she did not expect at all. And she did not wanted her husband to be in that space of birth. But she shed some tears while he was not there around. She said, I did not expect whatever he did today that he would do. And I said, yeah, this baby wants this relationship to go ahead, to have some love. And then, she cried and like, yeah, I feel that now. This birth will definitely help us, resolve all our differences. So, and then there again, she was like, urge to push, squatting and asking me, what should I do? So I said, tell I love you. I love you to your husband. The husband started laughing. And she said, I love you. When you say loudly to him so that, it's audible. And he's laughing. Yeah, she will not say it by heart. She's just saying, so that's how the relationship, like, I do not even, like, I think that they have never shared I love you to each other since so many years. So he was laughing. Oh, she's not going to tell me I love you. I was like, okay. So, but still. And then there was leak happening. Only few drops, okay? Few drops. And then Tapasya had told that once the water bulge is gone, you will feel good. The baby can come quickly. So the leak happened. 2 pushes. And look, she did not squat in a very sitting way. She was like very much upright and standing. I could feel a giraffe baby coming down. Droop. It was, the baby fell down. And all of us, we cried. And as soon as I took the baby and gave it to the mother, both of them, oh, hamari beti aa gayi hai. The thing she wanted to, not tell the husband. It was husband who saw the baby first. And then I saw that, they hugged each other, the mother and the father, they kissed. And then we took the mother to the bed. And there was an amazing skin to skin. And again, what was that video which you had shared, the birth story video of, I don't know, Kale, where
Kendra's
the
birth.
Kendra's
birth,
birth is the super hit, because both of my mothers, they sucked the meconium out of the whole body of the baby. We were like, oh, so that was the beautiful thing I could witness. That instinct which she was following, and there was so much of meconium which also came out, and but that really helped. And the meconium from the nose, meconium from the mouth. There were a few meconiums on the ear side, but then we just cleared it up. And the baby was crying. So by the husband was like, yeah, we like, everything is fine. The baby is crying. And Turand, on like just after a minute, they called the mother. The baby girl has arrived. They're like, what? You guys birthed? So yeah, we are at home and we gave birth to the baby girl. And so the sister-in-law, she came up to see, and I was like, yeah. And I think there's a lot of work after the birth. So yeah, so I was busy managing that. Uh, uh, Beautifully, like even just after 10 minutes of the birth, I could see a little placenta already coming out. So Tapasya told us that, it will take 20 minutes to get that contraction back. So at that time, we would need her to be getting the urge to again push, and then we can birth the placenta. So again, the magical, phosphorus was put in, some of the China, I think, these few homeopathy which Tapasya had asked us to keep ready, it was all there. And then the husband was taking care of the cleaning part. I was handling the mother, and after 1 hour, I think I could help her get the placenta out. Again, this is something is out of my scope, but I did that. I helped the placenta to come out, and then it was amount more like it was like 2.5 hours of delayed cord clamping. Like after 2.5 hours, we cut the cord, and the mother was happy, and yeah, so it was a very, very beautiful experience I could ever witness. And thank you so much, Tapasya, for trusting me and being like an elder sister. Someone is like, yeah, you will do it. Yeah, oh, nothing great, you can do it. So that helped me going at that at moments. Yeah, so yeah, prayers also help. So when I was a little engaged with the mother, so the father prayed. While the father was busy with the mother, I prayed. So that was a very spiritual experience for us. In all the birds, it is very uplifting how the mother surrenders herself to the Almighty's decision, and how the baby comes at its own time. It's not whatever we say and it will happen. So the father has said, you said it will come by morning. So Tapasya had to say, yeah, morning is till 12 o'clock. No, so still wait. It has not, the morning has not over yet. So yeah, so the impatience which the parents go through, and how as a doula and the midwife, how do we have to take care of those emotions, and how do we see emerging, the father emerging from being confused, being scared, and then he's being powerfully giving one statement which gives so much of hope to every one of us in the room. He's saying that you took care of the baby for 9 months, now can you not handle for one more day, we will do it. And I was like, wow, this was needed. But overall, it was a beautiful experience. And then the mother-in-law was looking at me like this, who is she? Later on, after the birth, oh, thank you so much. I was like, yeah. I'm glad that I was helpful. And the whole family got this experience. And now people are wanting, those who had cesareans, that, yeah, we would definitely want to try this. So about Mahinur, she was preparing for the birth since the cesarean of her second baby, that 2018. So the time period where she had, the time she has taken for educating herself, and the husband at that time surrendered, and he said, yes, I'm definitely supporting you. Everything worked, and like after so many years, she got what she wanted, HBAC, HBA2C, alhamdulillah. So yeah, that's about the birth.
Yeah. Amazing, Sneha. It's like you are a great storyteller. You kept everybody engaged. I just love her style. She's so bindas, Mumbai chi mulgi. It's like, yeah, that's what I want to see in a midwife. That fearlessness, that heart that connects with the heart of the mother and not with everything that is not important. Okay, so yeah, somebody asked, was there tearing? Yes, tearing happened. It was close to second degree. I would say deep first degree laceration. I would say it's like very deep, but yes, it tore through the muscle a little bit. But I asked Mahinur, do you want to go and get stitches? It's totally your decision. She said, no, it's very traumatizing. What do I do? So I asked her to do this calendula mother tincture douche, not douche, but just dabbing the area, and honey, and this castor oil and haldi. She just did calendula and she's doing really good. And little discomfort is there in sitting and all that, but it will take some time to heal the perineum. Of course, I mean a whole bus has passed through there, so But she's very confident. I asked her 3 times, do you want to get stitches? I recommend not stitching the area because it will be very uncomfortable for you. It will heal because I had seen similar tear with Zara also, sister Zara, who had her baby in November with me, like on phone, and her mother. So it was just similar. And Zara also had the the bulbar, what is this muscle called, that was coming out, but she said, I'm not going to get stitched. Yeah.
And for her, this birth was more of, I could feel when the first baby, like the first son of her, used to come into the room, she had a very different way of approach to him. When the second baby used to come, no, the moment he used to come and do nothing, she would just shout. So she used to get triggered with that second baby. And but obviously, as a mother, she also cares for him. She loves him. But somewhere she said, you know what, Sneha sister, I really want to get healed completely. Healed from my emotional stage, what I've gone throughout after the birth of my second baby with a cesarean. I really want to heal myself. And I said, definitely the mothers who they just had an elective C-section and the mother who bore the pain patiently will have a difference. She always says that, how are you homeschooling? How do you manage your kids? How do you this and that? I like the birth I've gone through has, showed this to me that, you've got to be patient around the kids. So she said, yeah, I really need to heal myself through everything I'd experienced in the past and start a new beginning. So for many mothers like this, it's a new beginning for life with their children, with their spouses. The perineum prepare before the birth massage. No, it wasn't. She did not do any perineum massage. Nothing was done for her.
So it's yeah, people think, perineal massage will prevent tearing. It's not. It's about the moment of birth. And Sneha also asked me that should I support the perineum,
Yeah.
but intuitively I felt no, that will disturb.
You froze. Okay, well, I feel differently about teaching teaching the mother about perineal support or about her. Actually, I teach them about the vagina.
Yeah.
Here in India in particular, there's a huge disconnect between women, their vaginas, their uteruses. What the hell is a uterus? They're completely, I mean, look at what they're saying about women. And so we already in India, women kind of are behind in the fact that with body shaming. They get body shamed. So many women that I see in India in particular disconnected with their vaginas and their muscles. So I and in fact, in particular, in this last year of working in India, and I've worked in India for a long time, but this year now, after a gap, I feel like I actually have to touch my body parts. When I'm talking, I now feel like I need to actually touch it because, I mean, look at it. Look at it. You can't go outside in India. It's the hottest damn place in the world. But no, I got to wrap as many cloths around my breasts because somebody else might get upset. We're shamed about our bodies. Now, that's our breast. Oh my God, there's a whole greater taboo about our vaginas. When when the baby's coming, there's a huge disconnect. They don't know what they're feeling. Even if you explain this, and I've always said, after a woman has her baby for the first time, got any other new way to describe labor contractions? Not. That's not what I thought it was going to be like. Yeah, I know. You got new words? No. How are you going to describe it? The same way everybody else describes it. But it's not what you thought it was going to be. Will it prevent tearing? I think it helps. I think it helps a lot if a woman gets connected with the muscles of her body. So as that baby slides down and into the pelvis and down along the back of the vagina, pressing into your anus, and all the women want to go, oh, I can't pass stool. Yeah, pass stool. Yeah, do it. There's this shame and discomfort. So they are disconnected from these parts of the body. So that's why I could take, and so when I'm even talking to them, yeah, your vagina, you know, this thing here, I actually get gross about it because, meaning, when I say gross, I mean, I got to put my hand on it. Otherwise, I'm not sure if anybody knows what I'm talking about. Geraldine, what do you got to say?
Actually, I think, when I studied my MBBS, this was a very important part, controlling the descent of the baby so that you prevent the tearing of the tissues, supporting the perineum. And of course, that's where the episiotomy came in, where I'm telling you how we were trained, so that you cut the, outlet so that there is a controlled kind of an opening, that was how we were trained. For me, when I had my babies at home, the midwife I had actually did the episiotomy for me, I was just, in those days, I was just learning, so I really didn't have support. But this doctor, my friend, was an obstetrician and had a nursing home. She was supporting me. So after giving birth and with this episiotomy, which my midwife had given, I would go to the nursing home and have my perineum sutured, Yeah.
To travel?
Yeah, I would. Yeah. I would go afterwards and get myself sutured. But then one more thing, Kiel, in my friend who's a doctor working in England, and her husband is a surgeon, and he was saying that most of the women have, prolapse or, yeah. So they prefer cesareans. There's urinary incontinence and everything, the urethral damage and so on. So a lot of them come in for repairs afterwards, after they have had a lot of babies, because that area has not been prepared to really, open up naturally. So that's why, antenatally, you should really massage and make the area perineum flexible for the baby to really come out gently. Gentle birthing.
Okay, well, I have a few things to say about that. A few things. Number one, I've never, oh, wait, sorry, I'm receiving a message. Oh, few things to say about that. Number one, episiotomy. In all my births, I'll say it again, I've never had an episiotomy in my life. I've never found it necessary. I almost came close to cutting an episiotomy in the very beginning of my career, and then the baby popped out. And yes, there is a bit of a tear, but we sutured it. You said something about prolapses, and yep, my hand goes up for that. You're right. Older women do have issues with prolapse, but I think this is part and parcel of the game.
And incontinence, good incontinence, urinary incontinence.
Look, I get it. I'm 68 years old, man. I know exactly what you're talking about. And it ain't just urine, urine incontinence. It's fecal incontinence too. Yes, ma'am. All this is waiting for you in your future. If you're stupid like me. Okay. So if you ask me, a cesarean section is a stupid way to avoid incontinence and It actually, I'd like to do the research on that, because when you're cutting into the abdominal muscles, you also have to avoid bladder involved ligaments and tendons. And one of the issues, main causes we have for women dying in Krishnanagar is the surgeons cutting through the bladder, because they actually, around here, my experience is the doctors actually don't know anatomy at all. I was told once how they could not see the bladder because the baby was in the way of the bladder. So these are people who don't even understand anatomy, but have a knife in their hands. So incontinence issues are part and parcel with postpartum. Cesareans don't fix the issue. And really, that's a really bad, I wouldn't personally suggest that as a means to avoid incontinence, as annoying as it is.
Yeah. Also, I would like to say something that birth practices currently, like pushing in supine stage and, pushing and yelling at the woman to push and giving fundal pressure, and when she doesn't have urge to push, all this leads to incontinence and not the vaginal birth. Doctors don't get it. I don't know why.
Because they,
Birth practices are wrong. Get the woman upright. Let her push when she wants to. Why don't you get that simple thing? I mean, sorry, I get started on this. I get
no,
triggered.
it's infuriating. Get angry. Why are they doing this? That's what they do, the fundal pressure. Never seen anything like it. Two women on either side of the fundus. What the hell is that? Or even nurses, I've seen them lean across they throw their bodies on top of the mother. What the hell are you goddamn doing? This whole thing, actually, the whole thing, even the story we're talking about, and before stories, we always go on forever and ever and ever and ever about this long lasting labor, which actually we're waiting for labor to happen. And I just wish we'd stop, just stop. The labor will happen when it starts. Again, just that example of the wind and the tide. You can't change it. The wind always blows. Sometimes it stops. Sometimes there's not a breeze in the sky. You can be out in the middle of the ocean. Not a breeze. That's hellish. And then the breeze starts up. But no amount of you doing what is going to increase the wind, people. What do you got in mind? What do you got in mind to change the tide? It's all stupid. And thinking about it and worrying about it and thinking of ways to change it just cause you more and more and more trouble. Just stop it. C-sections are cruel. Yes, they're actually, that's the other thing. C-sections are mutilation. They increase your morbidity. Morbidity means lifetime injury. You have been given a huge abdominal surgery. Yeah, it's not small. Yeah, Geraldine.
It's an absolutely terrible situation in these maternity hospitals. I myself get terrified to just go into the maternity, for women. It's really like, treating women like cattle. And these women are so desperate, and it's horrible, the current kind of training. And of course, most of these babies are precious, like these women are already programmed to having one or two babies. And after that, you're cutting your tubes on top of that, contraception, or you have this copper T shoved in. So it's a whole, attitude towards women, children, husbands and families. Of course, there are a few centers which are going in for this natural birthing, and but it's for women who really can afford it. But the poor are really suffering in these hospitals. I worked in all these major government hospitals, and it's horrifying. Women are really treated like cattle. And the birthing practice is horrifying, horror. It's absolute horror, like they were saying, shouting and pushing and, the whole nonsense. It's going to be very difficult to change. But I'm glad that's why I'm part of this group. Good. I think the midwives are the ones who believe and, who can really help women to understand that birthing is so beautiful and wonderful. And we really need to work towards, whatever can be done. There are a few women who are also looking for these options. So it's good to get this thinking out there, and this knowing that birthing, and for me personally it was Christmas, the celebration of Christmas that really made me think of birthing being so wonderful and beautiful. That was what started me on my natural birthing, gentle birthing and home birthing and breastfeeding and the whole works. Yeah, that's what I wanted to say.
Also, I wanted to say something that I didn't when you were talking earlier, Geraldine, I'm sorry. That we don't have backup care, and that's there in Netherlands. So I don't know where you were getting with that, but my question is, with whatever available, if a woman wants a home birth, like she knows there is not good backup, she knows she's not going to be welcome in the hospital when she transfers from a home birth, she's going to be abused, she's going to be harassed, she's going to be laughed at, mocked at, everything is there, but still she wants her baby at home, then we need to be those people who support that. That's what I'm saying. I know the infrastructure is not there, so what do? You go and go get a visa and fly to Netherlands? No, we cannot do that. Okay, so we need to create options here. So it's not enough to say, oh, we don't have midwifery care, oh, the doctors are too authoritative to give midwives their ways, because even if we have independent midwives in hospitals, doctors will always have their ways, because they will look at them as competitors and not as collaborators. That's always going to be there. So what about women who want their autonomy and want their home births? That's why, like, I have a very old gynecologist friend who is like 40 years of practice. He's a very sweet man. He always asks me this question, that, you know, but I say this, our point, the whole point of this group is not to change the system. We know it, the system is going to rot and it's going to die its own way. We are there to provide option for women who are looking for it. We are not going to convince anybody that natural birth is better, home birth is far far better, although I truly believe that. But one should birth wherever they feel safe. But what about the women who want it already, who know that they, like Mahinur, like I've done, Mubina is here. I think she was here for, yeah, Mubina is here. That lady has had 4 cesareans and she had a 5th home birth with me. So she was refused from everywhere. Like, even after 1 cesarean, people have to run from pillar to post to just to find a supportive doctor that will say, yes, we can at least attempt a natural birth next time, a vaginal birth, not even natural. So a primary section is so much. Forget about the VBAC. So we are supporting that. And if, tomorrow, if somebody wants to put me in jail for that, I'm ready to go. At least people will talk about it. I know what it feels like when you are told that you have to do a C-section, otherwise you will die, your baby will die. It's not true. 90% of the times it's not true. People are pressurized into unnecessary medical intervention all the time. So, that's what we are kind of fighting here. Not even fighting. I will say I am trying to link people, get them to the groups, get them to attempt this attending home birth of mothers who really want it and who won't blame you for anything. Mubina, Mubina's baby passed away after 12 hours of birth, but she never blamed anybody because she knew, that there was going to be something, and the families gracefully accepted it, because they know that even in hospital, death cannot be prevented anywhere. If a baby has to pass, it will pass as well in hospital. It's not that, hospitals can prevent death. No, we can prevent certain things, of course, but sometimes, you gracefully accept what it is. Miscarriages will happen no matter what you do. Stillbirths will happen no matter what you do. But it does not mean that every woman that is home birthing is at risk of death. No, it's the risk is as much as you will walk on the road and you will be hit by a car, a vehicle. So the risk is equal. So anyway, you are taking risk. So the whole point being of this group and connecting people is, let's stand for women who really want to taste the autonomy, to have their choices supported. And why not? They deserve better care. Like people in this group, like Mevan and Radhakund, we go to women in postpartum, like Sneha, we talk to them, we, give them tips, suggestions, lots of stuff that OBGYNs doctors will never do. They don't have even 10 minutes for you. The whole model of care is different. In prenatal, we are talking to that woman for an hour or two. What are you eating? What is your emotional state like? Who is talking to you in the house? Are you feeling some grudge or some sadness or something against someone? Let's express it, because that's what affects the pregnancy, and not all the supplements and this test and that test and all this. So it's kind of the whole model is different, and it needs to be nurtured. Again, women like us who nurture women, we need nurturing. So that's why we come to KL, because she provides us that space, that okay, all right, whatever you are doing. Sneha said, I am like an elder sister who just says. That's what KL did for me. She said, go attend, come on, don't be shy, don't be afraid. You know your heart lies in home birth. You know you don't want to be a hospital doula. You're getting frustrated out there. Don't do that. You have seen the beauty of home birth yourself, because I had my twins at home. And then I started, after getting frustrated with being a doula at hospital and seeing how authoritative doctors are, and how they are not supporting choices of women. There is nothing called patient's right in India. It's only there to hang on the wall, but patients are not informed what they're drugged into, what procedures are done to them. Nothing, no consent. So that's what KL did. Why do you want to frustrate yourself? Because most of the doulas working in hospitals in India, they will burn themselves out in 10 years. They will not want to continue. They are going to get frustrated. So most of the doulas need to look into other options, into birth keeping, because they are at some point going to find women that are going to say, I have taken your birth classes, chuck all this. I don't want to go to hospital. Will you come to my birth? And if at that point, if you say, no, something happens, I'll be hanged, no, I'm very afraid. She will birth her baby anyway. She will find a local dye, she will find someone, or she will just do it on your own, or she will find me. I will give her sessions and I'll be on phone. But we need people who want to be there, serve in person, sit at the feet of the laboring mom, and that's where you learn midwifery. Not in school, not from anywhere. You sit at the feet of women. So
Yeah.
that's what this model is. I don't know why I'm giving speech. But Kale just wanted me to take over, so I just blabbered all my mind.
You
What I
only
want
don't
to.
give speech during birth. उससे पहले you give all the speech. During birth, you just take that 1 minute call and you're out.
I remember one birth, like that was in Mangalore. The sister was showing the perineum to me whole time. Well, I don't want to see it. I mean, I want to see the baby coming, of course. But the mother is getting conscious, and sister is like, move that way, you come to the camera. Oh, holy. You don't ask the mother to come into the camera. She's giving birth, damn you.
How do you say that, Howli? That was amazing.
So and Sabina, अरे वो तपस्या मैडम देख रहे हैं ना, आप थोड़ा इधर हो जाओ. मैंने कहा रख फोन रख नीचे. I didn't want to see, but she made me see the whole birth. It was beautiful to witness, amazing. But for me to show the video, they have to switch on the light, everybody has to be there. The mother gets conscious. I don't want that. A birth is a very private experience. And the mother needs to do it with whomever she feels safe. Of course, she feels safe with me, but I'm not in the room. I'm there if something goes out of the way, but I don't want to see the birth. Even whenever I'm present at the birth, I rarely catch the baby. I ask the mother or the father to catch their baby, because that's the thing. They made the baby. They have the right to catch the baby. So it's anyway. Yeah, that's what I feel.
There's a thing in Australia called vagina dialogues. It's a bunch of vaginas that are talking.
Yeah, they had adapted that show in Marathi. It was called Vagina Monologues. Yeah, it was a very controversial play, but it got great success.
Oh,
In
wow.
Marathi, we have some
here.
we have experimental theater going on in Mumbai and Pune, and we had that fabulous play.
I know. Yeah, cool. Yeah, Geraldine.
I personally don't like objectifying the body, I mean, just calling ourselves vaginas or breasts or whatever. I would prefer that, it's a mind, body, spirit connection. Of course, the vagina is part of your whole self. It's you, So I don't like this whole kind of, it's more of a feminist kind of an ideology, pushing as if, vaginas or something. And it's an objectification and a sexualizing of yourself.
That's
It's your
not the
mind,
point
body,
here.
and spirit. Yeah. I
That's
don't think,
No.
I mean, I wouldn't want that. I don't like it.
No,
Yeah.
that's not what we are saying. We are trying to
Yeah.
say, let's not taboo the body parts. We want pregnant women to touch their body parts, to know about their body parts. That's
Yeah.
what Kale is saying. It's not. Uh,
Like
we
I don't
no way.
remember I talking
Yeah.
about TVs to Mahinur, but that was so instinctive for her to just put the finger inside the vagina. While I see so many women who menstruate and they do not want to use the menstrual cup only because it needs to go inside. I think what's the fear putting your own finger inside? But Mahinur was like so, that was so instinctive. I was like, wow, that was amazing that you did your own PV. And she was like, okay. And she was like ready to do it now and then. So while she was on the seat, she's just washing her vulva and just putting her finger inside. Why is it not coming outside? Why is it? I think, okay. So with that, you also need to relax and be patient. But that was amazing that she was aware of her body and, she was confident and okay with touching it.
So it's about, as far as I can see, it's about, well, and I had a conversation with another woman my age who I think she's had 3 or 4 kids and they were all cesareans, and she's my age. Back in the day, to have that many cesareans was unusual. So I was asking her, and she was listening to me doing my spiel about something, and she said, "This is the house you guys are staying at." And she said something about the cesareans, and I looked at her, and of course she's also a Hare Krishna devotee, and we're all weirdos. Isn't that right, Radhika? And so when I asked her, she told me this about cesareans. I said, "What do you think? What do you think about your vagina?" Oh, and she saw my books on vaginas. She goes, "I think they're disgusting." And I said, "Okay, and what do you think about your body?" "Oh, I hate my body. It's disgusting." Okay, you answered my question. So, one thing also, I've done births all around the world with all kinds of people from all kinds of cultures, all kinds of backgrounds. One thing I learned and know is that we all don't think exactly alike. We don't believe the same things. And guess what, people? I don't think any one of us knows a whole lot more than the other one. I think a lot of us are making it up as we go, best as we can. And I learned from other people by tolerating, not judging them. I liked what you said, Tapasya. We learn at the feet of the mother. So indeed, but I can't learn from her if I'm judging her. If I think I'm smarter than her. If I think I'm better than her, I'm pretty than her, she's an atheist, or she's a Christian, or any of these stupid things. As soon as I do this, I can't learn from that person. I cut myself off from learning. For me, it's always important to continue to learn, and you never know anything in this world. And at the end of the day, we won't actually know a damn thing until we've gotten to the other side, and we still don't know what that side is or what it is, and we can't come back and tell you what we found. So I listen and I support and I learn. So it's important. Oh, there's some things that we put a lot of pressure onto mothers, and I don't do this. I don't expect a mother to do exactly what I tell her to do. I'm kind of losing where I was going with this. But I just think it's important to me not to judge people, not to cut them off or try to change them, but learn from them and learn. Once you figure out what they need, how can I get in? How can I get in and help? Yeah. I hope that makes sense. And Saman, we ran out of time. And I very much wanted to hear your story. I wondered,
I could take it in the next class or
I have-
whenever.
I have two ideas. Either we start with you next time, or I make an appointment to ask you questions.
Yeah, sure. I'd love that.
Can we do a Zoom recording and I can ask you questions, and I might even ask your kids some questions.
I think I don't know. They are not very comfortable with the phone camera. No, they love to talk. And my 5-year-old daughter has already witnessed 3 births. So she loves to talk about it.
Okay.
But I'm not sure if she would be able to connect on the phone. But we could try.
Okay. Sounds like fun.
Me and Karan can have a conversation with you. We
Okay.
can start the next class with it. Yeah.
Yes, that'd be great. That'd be really,
Yeah.
really good.
Here's my 2-week-old.
Yay.
Hey, sweetie. Hey, sweetie. How are you? How are you?
Hey, congratulations.
Thank you.
Hey, nice to meet
How are
you.
you, Sister Saman?
Hi. Assalamualaikum, everyone.
I'm so happy you have your baby
And it was
outside of your
beautiful.
body.
But I'm not going to start talking about it because then it'll be difficult to stop.
I understand. I can't wait
So
to hear about it. Yeah.
we will talk about it in the next class, inshallah.
I'm so
Yeah.
excited for you. Congratulations.
Thank you.
Kariba.
Okay, thank you, everybody. That was great. I hope to see you all come back again on Tuesday, right? No, on Thursday, day after tomorrow. Okay, I'll see you all then. Okay. Haribo. Bye.